Hello, my name is Dr. Tom Van Ornum. I'm a doctor of physical therapy and a sport performance specialist. I'm going to walk you through the biomechanics and functional movement of the hip joint. Femoral acetabular anatomy allows for 3 degrees of freedom: sagittal plane flexion and extension, frontal plane abduction, adduction, and transverse plane internal and external rotation. In the sagittal plane, the hip can usually flex to 140 degrees. This is crucial for the mid-stance and swing-through portions of gait, as well as for squatting. The hip should extend to 15 degrees. This is needed for the push-off and terminal hip extension phases of gait. In the frontal plane, the hip should be able to abduct to about 45 degrees and adduct to about 30 degrees. Maintaining adequate hip abduction during single leg stance and avoiding excessive collapse into hip adduction is crucial for healthy hips and knees. Poor control of single leg stance stability results in increased compressive forces through the weight-bearing portions of the hip and knee, which can result in degeneration over time. In the transverse plane, the hip should be able to internally and externally rotate about 45 degrees in each direction. Adequate hip transverse plane motion is essential for reciprocal motions in the body such as walking, running, and rotational sports like baseball, golf, and tennis. That brings us to the end of our discussion. Thanks so much for joining me today.